My name is Chiti. I'm a TTRNS at the National Amyloidosis Center. I've had a huge amount of different disciplines in the nursing career, and now I'm on my path to being a specialist TTRNS at the National Amyloidosis Center. My role as a TTR specialist nurse begins when the patient has been given the diagnosis. I initiate the treatment with the patient in the center, and then I collaborate with the nurses who take over the care from me, continuing the therapy of the patient. These patients have systemic disease which affects other parts of the body, and they need care from other specialties. So I collaborate with other specialties like cardiologists, physiotherapists, psychologists, and genetics. So most of the times I deal with the emotional side of the patients and making sure that the nurses who look after these patients are taken care of, because sometimes the nurse will visit the patient and they'll find a problem that they are unable to address, which I have to help address, because as a prescribing center, we have to address the problems that the nurse is facing in the community. And this covers the entire England, Wales, Scotland, and Northern Ireland. In our department, in the National Amyloidosis Center, we have an MDT meeting, a multidisciplinary team meeting every week, which they address patients' conditions and queries that come from other specialties as well. In my role, the way I collaborate with other specialties is by providing clinic letters that contains all the information about the patient and what is required by that specialty, respectively. And I also do nurse consultation, nurse telephone consultations for these patients, where I address the problems that they are having and the symptoms that they are having, and then we work together with the patient in relation with the other specialties that can help them in their communities, respectively. The challenges mainly are based on the knowledge. It's not everyone who knows what amyloidosis is. And this becomes a challenge when one of my patients is admitted in their primary hospitals, where the doctors or physicians looking after these patients want some information, but they don't understand exactly what amyloidosis is. When the patient describes to them, I have amyloidosis, I'm on gene silencing therapy, they don't know what that is, and there becomes a problem because they start looking for that drug in their hospital, which they don't stock, but then it comes back to us. So that is one of the challenges. The other challenge is patients have anxieties and queries that they don't know, because from the point of the diagnosis, the 95% of the equation lies with the patient, which involves a lot of things: the aspect of family affairs, social, and other medical issues that they need to be addressed. So these are the challenges that sometimes are based on my role. Working with the multidisciplinary team helps me to overcome the challenges that the patient face, because I'm able to communicate or collaborate with these specialties, or the GP, for instance, in the community. If the patient doesn't know that they can have certain services, I will speak on their behalf. Being an advocate for the patient helps me to make the patient acquire the services that are really entitled to them. And sometimes also collaborating with other specialties makes it easier for the patient to be invited to have an appointment made for them, because they are not sure whether they can access these services. But through the National Amyloidosis Center and letter writing, the patient is able to have access to these services. When addressing these complex issues with the patients, I normally have to give the patient a platform to tell me their fears and what anxieties they have concerning their condition. And then from there, I address the queries that they have, because if I don't let them have a platform to tell me exactly what their fears are, it becomes a problem, because then it will just be me telling them. But I need to work with the patients, so shared decision making comes in place, and this is all centered on the patient. Holistic approach is the best approach that I've come to realize works well for addressing such issues with the patients. Treatment on its own is one part of the equation, but 75% of the equation for the patient lies with the nursing care. And this is why it's important to use a holistic approach in addressing the patient's issues.